Welcome back to the Osteophysio YouTube channel. Today we're going to be looking at what causes pain underneath the shoulder blade. So pain being reproduced in this area is incredibly common in clinic, and we see a lot of people reporting pain underneath the shoulder blade as well as around the shoulder blades, around the front of the shoulder and up into the neck. So today we're going to be breaking down some of the most common causes that we've seen in clinic that trigger pain in this area. So number one, the first thing that we're going to be talking about is myalgia or soreness of the main muscles underneath the shoulder blade. So there's lots of muscles that attach around the shoulder blade and blend around, but the two key ones that we're going to be talking about is your subscapularis, which is one of your key rotator cuff tendons, rotator cuff muscles. This is absolutely vital for shoulder stability as well as movement. It blends underneath the shoulder blade, so in the subscapular fossa, attaching into the lesser tubercle of the humerus. So really important if we're stabilizing the shoulder. So if anyone's doing any kind of workouts in the gym, so if you're physically using the upper body or day to day, we're kind of sat working and everything's dropping forward and that's impacting how your shoulders are moving, what can happen is we can get lots of soreness forming up underneath the shoulder. But what's more common in clinic is someone might report that it feels kind of deep underneath, that the shoulder's clicking, as well as getting soreness around the area. So what's more common that we see is it's not just in one specific point, but lots of areas that are tender. So what we would look at and what we would test for is how the shoulder blades are moving. So we'd want to look for any scapular dyskinesis, so anything where it's not moving properly. We want to look at symmetry and balance through the movement of the shoulder. We would then want to test the rotator cuff, so resistance in internal and external rotation, so particularly internal rotation for the subscapularis, and then we would palpate around and test to see what else is involved. Secondly, we'd be thinking about a key muscle, which is your serratus anterior muscle. This is attaching on the superior lateral part of the 1st to the 8th ribs, underneath that shoulder blade, attaching to the superior and inferior angles and the medial border of the scapulae. So its key role in the body is to help with protraction, so moving that shoulder blade forward, so moving the arm forward, everything going into that forward position with that rotation. Really key if we're doing any stability work through the shoulder. So if your job involves maybe overusing the shoulder or leaning forward, sometimes that can impact the mechanics and the movement of that particular muscle. Again, very similar to the subscapularis, inflammation or soreness in this area is normally linked with other areas of tightness. So what we want to look at is to see that shoulder movement in protraction and retraction, to see if it's moving properly against the thoracic cage. We would again want to palpate around to see how it feels, if there's any tenderness, and more importantly, kind of long term, looking at regaining that movement and regaining that stability. And this is something again that we've looked at in other videos on our channel. Next, the second thing that we want to talk about is referral from other surrounding muscles into the shoulder blade area. So it's very common if we're doing stuff day to day and we're stressed and we're lifting up through the shoulders, that we get a lot of tightness across the traps or into the levator scapulae muscles. So if the head's dropping forward, if we've got an anterior head carriage and it's very tight in the pecs and everything's dropping forward through the shoulders day to day, whether it's lifting or in that static position when working, this can cause a lot of tension and tightness to form, can start to feel quite stiff. So not only does someone report quite localized pain into this area, maybe stiffness or movement through the neck and the shoulder, but also might report referral around that shoulder blade. So it's really, really important when someone comes in that we're palpating around, checking to see how the shoulders are moving, how the neck's moving, resisting the key muscles and seeing if that reproduces the pain. Third, we're going to be thinking about any dysfunction or injuries to the rib joints around the back. So where you've got your shoulder blades sitting on the thorax and you've got muscles kind of blending between the two, what can happen if we're thinking of the spine and the joints coming in, so the ribs coming in and the joints in that area in the thoracic spine, we can get dysfunction around the rib head as it's coming in. or potentially if we've done something repetitively where we've twisted or moved, that can cause inflammation in the costotransverse or costovertebral joints, so the ribs, between the ribs and the spine. What someone typically reports is quite specific, localized, maybe one-sided pain around that rib, worse for breathing and moving, so when they're twisting that can trigger the pain. What also happens in conjunction with that, if you've altered your rib mechanics because of the pain, that can then form tightness around the shoulder blade up underneath. So they might report as a secondary symptom of tightness and tension underneath that shoulder blade. So we'd want to look to see how the ribs are moving, how the whole spine's moving. Again, checking shoulder blade movement, so looking at optimal movement through there, seeing what's going on, and then coming up with a plan to soften and release around the ribs and around that area. Finally, if we've got any inflammation or damage to the joints, so the capsules of the joints of the neck, that can also give a pain referral pattern down, sometimes into the top, if not lower, into that shoulder blade. So what someone might report is either repetitive movements or post-trauma into the neck, like a whiplash injury. They might report stiffness and soreness forming in the neck. It might be quite specific over certain joints. If the capsule's inflamed or the joints have become inflamed or they're tender around that area, i.e. from something that's happened, they might report that when they do certain neck movements, it gives localized pain over that joint, but also might report a dull ache or an ache forming down into the shoulder. So it's just as important to look definitely into that shoulder blade, but also look to see if it's possible referral from the neck, because you could be softening as much as you like around that shoulder, but if the pain and the injury is up higher and it's referring pain into that area, you need to be dealing with the neck as well. So we would check neck movement, palpate really thoroughly around that area, seeing what's going on, and then management would be getting all of that softened, all of that moving, checking mechanics and seeing how the person's kind of standing, how they're holding themselves, and then reducing any secondary points of tightness and soreness that might be adding to that injury. So as with all of our videos in terms of the frequently asked questions, you know, why are we getting pain in different areas? The first best step is to actually get it assessed properly by a musculoskeletal expert. As you can see today, where we covered, you know, very specific conditions, obviously there's lots of other things that can cause pain as well. It's a process of working out where the pain source is. So you want to get your neck assessed, shoulders assessed, have everything checked thoroughly. They'll be able to give you a specific diagnosis for your particular symptoms, an appropriate assessment, diagnosis and management plan to get you out of pain, and most importantly, to prevent the injury coming back again.